Hi, good afternoon. My name is Dana. I will be your nurse today. I am here to help assist with demonstrating and teaching you on how to take care of a pediatric child that has a seizure. First, we're going to cover how to demonstrate and protect the patient's airway whenever they're having a seizure. So I want to first show you a video from American Red Cross. We're going to play a short video on the seizure piece of it. It's just a little over a minute long. I'll review it with you. To care for a person having a seizure, you let the seizure run its course. Remove nearby furniture or other objects that could cause injury if the person hits them during the seizure. As said earlier, caring for the person having a seizure, when the seizure is over, you check the person for responsiveness, and if the person has any injury, you're going to first help them with the injury. You are going to check the person from head to toe and place the person in the recovery position, which is a side-lying position. Stay with the person until he or she is fully recovered and aware of his or her surroundings. Sometimes that takes minutes. It could be even up to an hour. You want to call 911 or the designated emergency number if the seizure lasts more than 5 minutes or the person has multiple seizures, if the person was injured as a result of the seizure, if the person is unresponsive after the seizure and does not come back to, because normally it should only take a couple seconds to a minute or two. Or if the person is pregnant or has diabetes, because there may be an underlying reason on why they had the seizure and it's a medical emergency. If the person is a young child or infant that had the seizure and it might have been brought on by a high fever, so that is considered a medical emergency. If the person is elderly, if this is their first seizure and it's not a known cause, and if the seizure took place in the water, because you never know if they aspirated any of the water. So that's from there. And then I also wanted to go over a few things with you today in regards to the seizures, and I was taking it out of our manual from the first aid American Red Cross. So first I kind of wanted to go over why you would protect the airway of the child, or if it was an adult, but we're focusing on pediatrics today. So you want to put them in the side-lying position, which I will demonstrate in just a few minutes, because you want to make sure that if they have anything in their mouth, as in blood, because they may have bit down on their tongue or on the side of their mouth, if they are vomiting and they have it in their mouth, because you don't want it to go down into their lungs and aspirate, or sometimes they just have a lot of saliva and mucus and they foam at the mouth, so you want to make sure that all of that is clear. So you would do that by a motion of putting them on their side, and then you would do a finger sweep in their mouth. Where a little baby, infants, and up to 1 year old, you would use the pinky, and if it was an older child or adult, you would use your pointer finger. So I'm going to go ahead and bring you over to the floor, and I'm going to show you what happens by using a mannequin and kind of demonstrate what you would do by clearing any sharp objects from around the baby, or also show you how to kind of do the sideline position as well. So come on, follow me over here. All right, so here is our little baby having a good time on the floor with lots of toys playing, and then all of a sudden you kind of notice they stared off and they kind of went down and they started having their jerking motion where they're having a seizure. You never want to hold the baby down. First, you want to start moving all objects out of the way that could hurt or harm. It might be anything from furniture to sharp, hard toys. You want to get rid of all of these kind of objects. You let the baby kind of have their seizure. You never want to try to put anything in their mouth to stop them from biting down. That is no longer in practice. What you do is you kind of let the baby have a seizure, and if you notice that the baby is vomiting, you turn them over to their side, and then you use the pinky finger sweep to get anything out of their mouth, such as vomit or blood. If that grosses you out and you don't want to do anything, with a child that you may not know, or if you want to have gloves, I did bring in some gloves. My household were medical, so we always have gloves, but you may not have these at your home. But if you do, you would put gloves on your hands first. Both hands. And then you can do the finger sweep for older children or the pinky sweep. All right, and then afterwards, after the baby's done having a seizure, is when you're going to assess if there was any injury. You're going to notate all time, like whenever the baby's seizure started, you wanted to look at a clock to see in time. If it was over 5 minutes, you're going to want to call 911. And if it was just a minute long and you know that your child has seizures and it's not a new seizure, then you don't have to call anybody. You may want to talk to the neurologist, but that's it. You take your one glove off, if there's anything in it, and then pull the other glove over it to keep any of the residue that may have happened during the seizure. And then you never leave the baby alone. You pick your baby up and you bring him with you if you need to call 911 or the doctor, because you want to assess to see, is the baby's temperature okay? Was it a fever that brought on the baby's seizure? Or what else might be going on? Or if he has another seizure, you want him to be with you. All right. So this is the point where I would ask you to demonstrate with me by getting on the floor and moving things out of the way, and you would tell me what kind of objects you would move out of the way to make the environment safe, and then how to protect the airway by doing the side-lying position. So you would go over that. The next piece, I'll put a little baby down here, is I want you to verbalize different things on how and ways on how to make the environment safe. So you remove any nearby furniture or other objects that may injure the person. You protect their head and limbs from injury by placing something soft under their head. Say you had a sweatshirt or a pillow, you can maybe put that underneath the baby's head during the time so that when they're shaking their head, their back of their head's not hitting the ground. Understand at all times that your child should not be climbing a ladder, playing on the playground, anything like that by themselves, climbing trees without your supervision, for one. And number two, make sure that whenever you are the baby's in the bathtub, you never leave them alone, or whenever they're swimming. Even your teenagers eventually get to the point, or even an adult, you never want to let them swim alone because they never will know whenever a seizure is going to come. So you want to make sure that they always have a buddy system. Someone's always watching them. So this is where you would then verbalize by showing me like the demonstration on how to move things out of the way, and then what other things that you need to know about keeping the environment safe, such as the ladders, not putting, cutting the tree limbs on the top of, or cleaning off the roof without somebody up there. And then whenever you're a baby, make sure they're not playing on all the different playground equipment without you, or swing. And then the third thing I wanted to go over today is verbalize the steps that you would take to keep your baby safe or your child, and when to call 911. So we would discuss the principles of managing a seizure, which are to prevent injury, protect the person's airway, and to make sure the airway is open after the seizure has ended. Do not hold the patient down. You make the environment as safe as possible. You give care to the person who has a seizure the same way you would an unconscious person. When the seizure is over, you make sure that the person's airway is clear. So you would do the finger sweeping. And you may need to call 911 if the patient had a new onset seizure, if the patient had multiple seizures back to back and they're not controlled. Sometimes you have a child that has seizures and they have diazepam or something that they can get rectally given to them that is administered at home, and they may still have another seizure. That is still warrants a 911 call and bringing them to the ER to be assessed. You want to make sure the person has not injured themselves, and if they have, they may need to go to the ER to have further care. They may need stitches at that point. The person may not have any seizures ever known, may be a baby with high fever, which is called febrile seizures, so that needs to be addressed as well. Or if the seizure lasts greater than 5 minutes, because that is considered an emergency. Even if they are known to have seizures, they shouldn't have them that long. And we can go over this, and we would spend a few minutes going over and reading over this, and then if you have any questions, you can ask me, and then I would, at this point, kind of quiz them on different things that they have read through this regarding what to look for with seizures, when to call 911, and then a little bit on the febrile seizure part. And I think that's about it. And if you have any questions, you can always ask me. I'll give you my business card, and you can call me even if you have questions later this evening. Thank you. Bye-bye.